Welcome aboard the Just Help Out Mindset podcast, where your compassionate guide, Nicole Venegas, takes the helm. Brace yourselves for an immersive experience as we delve into the heart of crucial conversations. We're set to explore the intricacies of suicide prevention, navigate the landscape of mental health, and boldly shatter the stigma surrounding therapy. This isn't just a podcast, it's an odyssey of resilience and understanding. Join us on this transformative journey filled with stories, insights, and a collective mission to create a world that embraces the strength of empathy and helping others. Fasten your seatbelts. We're about to embark on a voyage towards a healthier, more compassionate existence.
Welcome, listeners. I'm your host, Nicole Venegas. This podcast is named after our nonprofit called the Just Help Out Foundation, which is located in Tampa, Florida, and was created from a pure tragedy. My brother died by suicide on May 3rd of 2022, and that horrific day will be forever etched in my brain. A few days before he did it, he said he was feeling hopeless, so our nonprofit organization helps anyone in the community who may be feeling hopeless. And everyone that we help in the community is called a Joey. So far, after being around for 1 year, we have been able to help almost 50 Joeys since our inception, from homelessness, hunger, domestic violence, and mental health. The purpose of this podcast is to explore mental health in its entirety and to let everyone know you are not alone. If you think you are the only one suffering from anxiety, depression, OCD, panic disorder, agoraphobia, I challenge you to think again. I am also a mental health professional and see clients daily who are strong and courageous, and they have decided to talk about their feelings and process unturned stones in their lives. I hope you will do the same with me here today. In this episode, you will get to hear from our absolutely amazing guest, Dr. Emily Rose Kalambaheti, also known as Dr. K, as we discuss the topic, is depression all in your head? As a clinical neuroscientist with a passion for pediatrics and psychological wellness, she serves as the Chief Clinical Officer and Director of Rehab at Genesis Brain Institute. She examines and treats patients with post-concussion syndromes, traumatic brain injuries, cerebral palsy, autism spectrum disorders, and more, while continuously investigating the newest and most efficient technologies available for neurological rehabilitation. She also speaks publicly about brain health, neurorehabilitation, and improving standard of care for neurological and psychological wellness. Dr. K, welcome. We are so excited to have you here. The listeners are blessed to get to hear from you. So I would love for you to just introduce yourself.
Well, thank you so much for having me on your podcast, Nicole. I'm very excited to be here. Being able to break down this stigma of mental health and people seeking out help is something I'm very passionate about. From a personal level to a professional level, I've seen what can happen when people do feel hopeless and they do feel alone and they don't realize that, yes, depression's in your head because that's where your brain's at.
That's right. Yes, absolutely. And before the show started, Dr. K was so wonderful, was sharing some personal stories with me. And I think it's important that our listeners hear this. So Dr. K, if you feel comfortable sharing your personal experience with depression, anxiety, and things that you've seen in your life that have kind of led you to this path, that would be phenomenal.
Absolutely. It gets easier to talk about every time you talk about it. All right. And I've definitely look up to you with how you've really embraced this with what's happened in your family and the tragedy of your brother's death. I have been in not the same, but a similar situation of getting that text, on a random weekday of I love you from a little brother that wouldn't normally text that, followed by a call from my mother that he had attempted suicide and was being ambulanced to the hospital. So having experienced my brother's suffering, having lost one of my great uncles to suicide, and having suffered from depression myself from a young age, even throughout today, it's something that I am very passionate about because I can see how it affects not just that person, but the community when you lose someone who had so much more to give.
Absolutely. I am so sorry to hear about your uncle. And I am very thankful your brother is still here with us, but also very sad that he went through that and he was struggling and attempted to do that. And you shared with us that you've experienced depression yourself. Do you remember about what age that started at?
I was young, around 10. I remember kind of first realizing that like people wake up happy and that seems crazy to me. Yeah. I started therapy and medications when I was 13. Wow. And by the time I hit college, I was trying to go a little bit more of a natural route. The medical profession I'm in, I don't prescribe drugs. I don't do any surgery. I just use my hands, technology, and kind of more natural ways to help people that are suffering from neurological or psychological illnesses. So from there, I've had the opportunity to utilize a piece of technology called transcranial magnetic stimulation, which has been getting a lot of excellent publicity through the research that Stanford's doing, being able to help people that are not responding well to antidepressants or standard medications or therapy.
Yes, and we are definitely going to dive deep into that. Absolutely. I do want to go back to, I think something you said was very, very important, that at age 10, you didn't wake up happy anymore. And I have a lot of clients that feel the same way. All of a sudden, they were fine, everything was good, and then they turned a certain age, a young age, and all of a sudden life just wasn't the same. So the fact that you experienced that at such a young age is devastating, and it always makes me want to research more, like what is going on with the brain. Why? The question is why? Why was everything okay before 10 and then all of a sudden now it's not? What changed? Was it something external? Was it an environmental change? Was it a chemical change? What is it? I'm kind of a little obsessive with learning about the suicidal mind and depression. Currently reading a book by Matt Haig called Reasons to Stay Alive. And one thing that's very interesting that stood out to me was that he said depression will affect millionaires. It will affect people with great hair. It will affect people with Ferraris, people with kids. It doesn't care what you have or what you look like. And the tough part is that it's an unseen disease. So we can't see your suffering internally. And there's other parts of the book where people describe, it feels like their brain's on fire. It feels like they have bats in their chest. And can you imagine having that feeling all day, every day, and you just want it to stop? So, of course, we put you on medication. You were on medication at 13 years old. Do you remember what medication that was?
They switched me from, Prozac to Zoloft. I feel like it's always a little bit of a guessing game.
Yeah.
Trying to figure out which SSRI. Mm-hmm. I've tried Wellbutrin. I've tried Effexor. Mm-hmm. So I've tried the medication route, most definitely.
And those are heavy medications for a 13-year-old.
Yeah.
So that in itself has its own effects. So that is why I am so excited for Dr. K to talk more about Genesis Brain Institute, which is located at 3030 Rocky Point in Tampa, Florida, because they're not only offering the TMS route, but they have so many other treatments that are non-medication that you can check out. So I'm going to let Dr. K kind of talk about different treatments they have over there and the things that it can help you with.
So the fun part about neurorehabilitation is that when the brain functions better, people tend to feel better. When we talk about depression, we know that it's dysfunction on an electrical level of different brain regions. We know that the neurotransmitters are affected, which is why medication tends to be the first route for a lot of people. But if you can create healthier connections and more connections, called synaptogenesis, making new synapses in your brain, you can help encourage neurotransmitter production as well. So we do that with a lot of different types of neuromodulation. Neuromodulation encompasses everything from using electricity to electromagnetic fields to even different types of light or vibration to activate regions of the brain that we know are dysfunctioning. And the way we recognize which areas your brain is dysfunctioning in is through QEEG, or quantitative electroencephalography.
Yes. That's my favorite thing that you do. I can't wait for you to describe this.
So it's maybe colloquially known as brain mapping. And the thought is that we have the technology to measure the different types of brain waves. And there's several different types of brain waves. We name them based on how often they occur. So if they're occurring between 1 and 3 times a second, it's delta. And then there's theta that's a little bit faster. And then alpha is a little bit faster. And then beta, and then high beta, and then up to gamma. So being able to look at the different amount of brainwave activity in the different areas of the brain. Right now we're using a 19-channel cap. And I know in some research studies, they'll go up to 254 channels. But being able to isolate which areas of the brain are not communicating efficiently. And are they hyper or hypocoherent? Meaning if you're speaking coherently, you can be understood. But if you're incoherent, those areas of the brain are going to have a harder time being understood or listened to. And sometimes it's because they're doing too much, hyper. Sometimes it's because they're doing too little, hypo. So being able to really isolate and create an individual map of that person's brain. And what's happening in your brain because you have depression is not always the same as what's happening in someone else's brain because they have depression. Depression is a diagnosis, but it's not necessarily giving you location by location breakdowns of what's going on in your brain. We're individuals. We're humans. We are an accumulation of all of our experiences, all of our genetics, all of what we've taken in, and all of what we haven't.
Absolutely. And I love that you said that, because depression is not a one size fits all. That is why medication is so difficult, because what may work in patient A is absolutely not working in patient B and could be causing all the adversary effects. So the QEEG is the one I sat in on, and I found it absolutely fascinating to be able to see the alpha waves in the brain, how they're working, how they're not working, where you can see the different levels, and how you can see the TMS would balance that back out so that the patient would start to feel happy, to feel joy again, to feel some motivation. So that's only part of what's offered at Genesis Brain Institute. There's so much more that you guys offer. It's amazing. So what else do you think is important for people to know? That's there.
I think most importantly, know that there's options. If you don't want TMS or you're not a good candidate because maybe you've had seizures in your past, there's neurofeedback where we use biofeedback, but with EEG activity. So neurological biofeedback. We also do heart rate biofeedback and breath rhythm biofeedback to help get you more in control of your body and your heart rate and your breathing and your brain waves, and give you that control that I know people feel they're lacking when their brain kind of hijacks them. Yes. We also have transcranial electrical stimulation, and this is a far, far, far cry from the electroshock therapy of the 80s. This is gentle. There's very few side effects, if any. A lot of people, the side effects are just from where I put the little wet sponges on their heads, or a little bit of pressure because I have to put a little headband around them. But we use a device called the Fisher-Wallace device that is FDA approved to help with insomnia and help with depression.
That's amazing. And how about the hyperbaric chamber?
So what I love about the hyperbaric oxygen is that it just helps healing happen faster. Every cell in your body is utilizing oxygen. And normally, oxygen has to be carried by your red blood cells, which means if you're anemic or you have poor circulation, you just get less. And that's not fair. So the way we even the playing field is by putting our patients in hyperbaric oxygen chambers for a little over an hour and letting them breathe in oxygen that's 4 or more times as potent as what you breathe just, in day-to-day life. And then we pressurize the air around them. And the laws of physics tell us that anytime you put a gas under pressure, if you put enough pressure on it, you can get it to dissolve in a liquid. So you can actually pressurize the air around you so that the oxygen that you're breathing in will dissolve in the liquid portions of your blood and get into those nooks and crannies that maybe we're having poor oxygenation or poor circulation. So I know that's pretty heavy neuroscience, but long story short, hyperbaric oxygen can help speed up your results from other therapies like TMS, like neurofeedback, like electrical stimulation, so that you don't have to wait as long or do as many treatments.
Wow. And there's different treatment options. So first, the client would get the diagnostic done, and then you would kind of write them a script for what kind of procedures to follow.
Absolutely. Every patient gets a customized individual treatment plan because that patient's brain is different than any other patient's brain. Yes. And we have to respect that individualism. My first ever research study was on neurofeedback in children on the autism spectrum. And in the autism community, it's very well known that if you've treated one kid with autism, you have treated one kid with autism. You cannot really use anything that worked for that first child for the second child without doing the due diligence of diagnostic testing and figuring out what that second child needs. And I think it's kind of interesting that in the autism community, that's so obvious. Well, what is autism if not abnormal brain functioning? Well, all neurological and psychological syndromes are abnormal brain functioning. So we should really be looking at all of those syndromes and disorders as unique to that individual so that their care plan can be just as unique so you can increase your likelihood of getting good results quickly.
Oh, gosh, you are saying the best things ever. So, can you tell us about like a success story of someone who came in?
Yes, there's this guy, we'll call him Jay.
Okay, Jay.
First initial. He actually did not come in the first time I saw him. He had long-term social anxiety, had really fought hard to get through it, then was in a car accident, got a concussion on top of it, and the agoraphobia that he had worked on for the last decade to finally get to a point where he was going out, getting his own groceries, things like that, had all come flooding back in, which makes sense. When your brain is injured, it kind of goes back to using the pathways that it had used when it was injured or when it wasn't so healthy. So he didn't even show up to his first appointment. We ended up having to do it via telehealth because he just could not feel comfortable enough to leave his home. And he was scoring severe on the depression index, which I use a PHQ-9. He was showing moderate on the anxiety. He was showing severe in the PTSD realm and severe in the post-concussive realm as well. But he was stuck in his home because of his mental challenges that he was having. So then when I finally did, I showed him around the clinic using my computer screen and made him feel a little more comfortable and explained to him that he wouldn't even have to drive. We would call a Lyft or an Uber to pick him up, try to make it as seamless as possible for him. I finally got him in. I think we treated him for just 5 or 10 sessions. And all of his depression and anxiety and PTSD scores went to none to minimal.
Wow.
After 10 treatments.
After 10 treatments?
Yes.
Oh, that's phenomenal. That is so wonderful.
So now he's going out, he's getting his groceries. He's actually kind of excited for the holidays and seeing his sister and family.
That is amazing. That's wonderful. And that's just one of many, many stories that have been successful from these different treatments, and not from Prozac, not from Zoloft. And by no means am I a medication pusher. I do agree that you may need that in some cases to stabilize. But these treatments they're just non-invasive. They're not getting into your body like these medications with these side effects. So I think it's very, very important if you're nervous about medication to check out these alternative treatments.
And I wanted to follow up with that. Yeah. Medications are great, especially when you're in the throes of a panic attack or you're in a point where that is what you need. But the thought being that some of the neurorehabilitation can actually create new pathways, new synapses. So that's called neuroplasticity. And the thought is neuroplasticity can make permanent changes, or at least changes that will last until some adverse effect. Like if you hit your head again or have a high fever, maybe there'll be some slip back. But the medications, they're really great at what they do, but they don't necessarily encourage new pathways or new connections in their brain the way neurorehab and neuromodulation does. So there can't even be a benefit of doing both and then weaning off the medication.
Wow.
Through the advice of your healthcare practitioner, that your psychiatrist or your PCP.
Yeah, absolutely. Well, we're getting ready to wrap up, but I do just want to ask another question. In collaboration with all these other treatments, how do you feel about therapy, talk therapy? Of course, I'm biased. I think every single person should go to therapy and talk about their feelings, talk about things that have happened. But what is your personal view on combining therapy with these treatments?
It's that much more beneficial. And I'll tell people too, I can make your brain, function differently, make it so it's easier to stay out of that fight and flight, but I can't necessarily take away your triggers. You need to talk about them. You need to address them. Like you said, look for any unturned stones in your life that perhaps are continuing to weigh you down. So talk therapy definitely has a role in improving, especially the anxiety disorders and especially people that are experiencing depression or PTSD, because the brain can get better. But if there's still triggers that throw you right back to where you were, we need to address those too. And talk therapy is a great place to do that. That and cognitive behavioral therapy.
Yes, absolutely. And that's something that I use daily on my clients along with DBT, exposure therapy, solution focused therapy, motivational interviewing, all kinds of different techniques. And even one more last thing, I think it's important to note that we talk about first responders and we talk about veterans because there's such an increased risk of suicide. I am married to a firefighter. I see firsthand the effects of PTSD and the calls that they see, things that they have to go through. Something that is gut-wrenching for me and will always pretty much make me sick when I think about it is that my brother died in my husband's arms. So not only does my husband have to see the calls that he sees, but he has to always remember the call he went on that he'll never be able to get out of his mind. As a first responder and a veteran or someone in the military, they're told to be strong. They're told to just suck it up. They're supposed to be getting better with that. But I still see it with amongst all of those, all of the first responders, police officers, the vets, that they are still nervous to talk to somebody about what's going on in their head. They're scared of getting fired. They're scared of being judged. So what is your opinion on getting first responders and vets over to do some treatments like this?
There are different offices in the U.S. where the firefighters in-house have neurofeedback, and it works very well for them. Being proactive, an ounce of prevention is worth a pound of cure. I think Ben Franklin said that. But being able to do baseline testing or QEEGs on our service members and our first responders so we can spot when they're having these challenges, so maybe they don't have to be the ones that bring it up. If we did some sort of screening, we might be able to help these people before they suffer.
Yes.
And isn't that what we want to do? Instead of making people wait until they're suffering so badly that they feel like they have no other options, let's be preventative. Let's be proactive and encourage our first responders and our servicemen and women to please have your brain assessed.
Proactive. That's the key there. That's the key, because we don't want you to suffer. We don't want anybody to suffer. So as we wrap this up, again, I just want to give you the website to go to genesisbraininstitute.com, located at 3030 North Rocky Point Drive in Tampa. There's hotels all around, gorgeous, right on the water. If you want to come down and check it out. Dr. K, how can someone get a hold of you?
Our phone number is 1-833-282-7246.
Wonderful. I highly recommend you check out Genesis Brain Institute. It's a no-brainer. Thank you so much for tuning in today. Tune in next week as we continue to break down the stigma of mental health.